Hey, what's up? So, is it a scab or Eschar? What do we do? How do we know? I can't tell you how many pictures I've been seeing lately of wounds. They've been post surgical wounds and they are very clearly an Eschar. This is a wound that is not progressing, it's not going to get better on its own. And people go back to their doctor and they're being told to just like, oh, cover it, just keep putting gauze on it and let's see what happens. And then all this time is passing. I cannot imagine how upset I would be if I had gone in for a tummy tuck, right? Obviously, if someone goes in for a tummy tuck, they want to look better, and their skin for whatever reason isn't responding well. There's not enough blood flow. Maybe proper wound care wasn't done afterwards, and now they've got black eschar. It's been weeks or months. It's been longer than it should be, and this area is still open. And now they're going to need to go in for a revision. I would be so pissed. I'm just saying. The least we can do is give them proper wound care. And maybe if you're a physical therapist, maybe you're not seeing like post tummy tucks, but you are seeing plenty of post-op patients. So how do you know, right? They're going to ask you, is this wound look okay? And you're probably scared to look under the dressing if you're not comfortable with wounds in the first place. But how do we know? So a scab, everybody has fallen down and skinned their knee. A scab is really just a collection of dried blood or fluid, so the exudate, the wound fluid that comes out, and it's just dried. And that's going to slowly, it's usually much smaller unless it's like a whole area that's been skinned. But if they've had surgery, right, you're not going to expect like the whole elbow to be gone. It's going to be a line, and there might be some little scabs along the way, maybe where the stitches were or the staples were, and right at those dots or right along the incision, it's completely normal to see a little bit of a scab. So what do you do for that? They can clean it. If they're, in the shower, likely it's gonna just kind of slough off, and that's totally normal. As that wound heals, as the wound starts to close from the inside out and the bottom up, that scab's just gonna start to lift off from the edges, and that's totally normal. That's what we want. But we don't necessarily want to pick it because we don't want to be having open tissue that's a portal for infection. So if you're just letting it slough off on its own with a scab, that's totally fine. Now, eschar, completely different. So that is going to be dead tissue. And in an incision, it's probably along the incision, and it's probably going to start to grow and become bigger. That's just dead tissue, and it's probably from a lack of blood flow or bacteria or something like that in the wound. That looks thicker, it's black, it feels like, if you were to feel it, it feels deeper. So dead tissue never is all of a sudden going to become live tissue. It actually needs to be removed. So that's debridement. Now, depending on how your comfort level, what you're allowed to do, what the surgeon's going to allow you to do, that really depends on where you're at as a clinician. But there are things that you can do. I would feel comfortable doing sharp debridement on someone, and you might not. But you can definitely put more of an occlusive dressing on it, which is going to encourage autolytic debridement and get that eschar to start to slough up, soften up, and then we can use things like enzymatic debridement. But of course, the quickest, most effective thing is going to be to take it off, cut it out. So it just really depends on your comfort level, but really just learning to recognize the difference between a scab and an eschar is huge. Eschar needs to be removed, so that's like a really, there's no point in waiting. You're either making a referral or you're going to take care of it yourself. And really just keep making sure and communicating that with your clients, your people that are coming in. Take a look, get more comfortable, start looking at things. If anyone here wants to feel more confident with wounds, and I'm putting together a summit. It's going to happen at the end of June. It's going to be kind of like a post-op masterclass on incision care. Hey, Amber. So you can go ahead and let me know if you want to be on the wait list for that information. That's going to go live in June. So I'm putting it together. I'm interviewing experts now, getting everything going. I can't wait. I'm very excited. It's huge project. And of course, I want all clinicians to feel more comfortable with recognizing what's going on with wounds that walk into your office. So I really hope everyone participates. And then also, if you are someone that has a wound, I do consultations. So if anyone is concerned about what is going on with their site, feel free to reach out if you feel like you're not getting the information that you think you need from your doctor. I'm more than happy to take a look. And if anyone wants that information, you can let me know and I'll give you the link to set up a consultation. But Amber, did you have any questions or anything while we're on? Today we were just talking about scab versus eschar, how you tell the difference, and don't wait. If it's eschar, it's dead tissue, it needs to be removed. The sooner that we get it out of there, the sooner your body can start healing and get you on the road to recovery. No one wants to be dealing with dead tissue. We got to get rid of it. We got to move forward. All right. Thank you so much for joining me. I'll talk to you later. Bye.